My name is Allison Payne, and today I will be demonstrating a bed linen change. Upon entering the room, I would perform hand hygiene and identify myself. Then I would identify my patient using two forms of identifiers, the patient's name and their birth date, compared to their hospital wristband. Okay, and then I'm going to use a antiseptic hand sanitizer, and while I'm ensuring that is completely dry to ensure the complete antiseptic effect, I'm going to explain to the patient why we change bed linens. We change bed linens to ensure no further illness comes to the patient, like bed sores or skin irritation, and just to keep them clean. We don't want them laying in soiled linens, to keep them as comfortable as possible. Okay, to start, I'm going to lay the patient down in a laying position, in supine position. Okay. And I have already ensured patient privacy by closing the curtain, and I'm going to adjust the bed to a proper work height for my liking. I'm going to lower it just a little bit. Okay. Then I'm going to lower the bed railing. Alright, and with an actual patient, I would ask them to roll over and hold on to the guard railing. But since I'm using a mannequin, I'm going to ask my assistant Morgan to assist me when we position her on her side. I'm going to start by removing the top comforter. The only time you would remove the comforter is with an order to do so, or when it is visibly soiled. And I'm just going to push that as far back as I can. Alright. Then we're going to roll her over onto her side, keeping her as covered as possible. Okay. Like I said, you want to keep her as covered as possible with that top sheet to ensure patient privacy. Okay, I'm going to begin by removing the dirty bed linen, rolling it under as close as I can to the patient's back. Always keeping her covered to ensure privacy. Okay, I'm going to continue rolling at that side. Alright, now I've already checked to make sure all my supplies is here before entering the room. I'm going to get the new sheet, and you don't want to fan the sheet when you're opening it to ensure that it does not get contaminated. So you want to unfold it gently. Okay. And I'm going to securely attach it to the side of the bed, tightly ensuring that you keep wrinkles all from the bed linens the entire time you're changing them. Because wrinkles, it can cause bed sores, skin irritation, and sometimes they're just not comfortable. So we're going to attach this one to the side too. Again, keeping it as tightly as possible. And then pushing the excess that you will attach to the other side as close as you can to the old bed linen, ensuring not to contaminate it. Okay, and we're going to pull the sheet back out to keep our patient covered. All right, and we're going to roll her back over. Okay. All right, and then I'm going to lift the bed railing. Again, ensuring that is tight. All right. Going to come do the other side. Excuse me. All right, and I'm going to do the same thing on this side. I'm going to lower the bed railing. Okay. And I'm going to turn her over. Again, Morgan will be assisting me. But I would normally ask the patient to hold the guardrail. All right, keeping the patient covered we're going to remove this side and start rolling, keeping the contaminated part of the bed linen contained. You want to be sure not to touch this to your scrubs or to fan it around in the air. Okay? Because you don't want to contaminate yourself or anything else that you might take with you into another patient's room. Okay, and you're going to place this in the proper receptacle. Today I'm just going to lay. All right. Okay. I'm going to pull the rest of the clean bed linen over this side of the bed. Again, keeping it tight as possible. Anytime you have to assist a patient by moving one of their extremities, grab that joint to lift so you don't cause an injury. All right, again, I'm going to keep it as tight as possible. Right, keeping the patient covered. We're going to roll her back to her back. All right. Now I'm going to take the top sheet. Again, not waving it in the air too much so you don't cause contamination. Okay, and I'm going to ask the patient to hold the top of the sheet to ensure that they keep themselves covered, but Morgan will be assisting me with that again today. Make sure it's good. Okay, and then I'm going to begin pulling the old sheet, old bed linen out from under her, keeping her privacy intact as much as possible. Again, not touching your scrubs or waving it throughout the air so you don't cross-contaminate anything. All right, then I'm going to adjust the sheet so I can tuck it in the bottom. All right, I'm going to raise this bed railing while I finish tucking them in at the bottom. All right, I'm going to gather the comforter, go over. Okay. Now I'm going to get the sheet along with the bed comforter, pulling that top sheet as tight as possible, along with the top cover. Okay, get it as tight as possible. Tuck it and pull it as much as you can. Keep those sheets nice and tight. Okay, then I'm going to grab and tuck those corners, ensuring that everything is nice and tight. All right, I'm gonna go to the other side. Okay. Again, pulling that top sheet tight. And do the corners. All right. Now I'm going to change the patient's pillowcase, ensuring that I support her neck or asking them to sit up for just a moment. And I want to change the pillowcase as quickly as possible so the patient does not have any discomfort. Again, discarding in the proper receptacle for the bed linen, ensuring not to touch it to yourself. Also, when changing the pillow, you don't want to tuck it under your neck. You want to thread it through the pillowcase. Okay, so we're going to grab it through. Okay. All right, and again, supporting the head and neck area, placing the patient back in position. If the patient requests to be lifted up, you can go ahead and raise their head, making sure that they are comfortable. That was good.